Hello everyone. In today's class, we are going to discuss about smallpox. I'm Mrs. Jansi, clinical instructor working at Triple M College of Nursing. So the introduction, the disease is also known by the Latin name variola. Frequently, it is a fatal viral disease and believed to have begun in Africa. Smallpox was responsible for estimated 300 to 500 million deaths in 20th century. The term smallpox was first used in Europe in 15th century to distinguish variola from the great pox, that is syphilis. Variola vera, which is a derivative of the Latin varius, meaning spotted, or varus, which means pimple, and spreads to India and China. So let's discuss what is definition. It's an acute contagious viral disease with fever, pustules that usually leave permanent scars. Smallpox is very serious illness caused by a virus called the variola virus. Smallpox gets its name from the pus-filled blisters that forms during the illness. So it is nothing but the pus-filled blisters. Incubation period is between 7 to 17 days after exposure. Mode of transmission. Smallpox is contagious. That means the virus can spread to others. So this spreads through tiny drops of an infected person's saliva when the person coughs, talks, or sneezes. Smallpox usually passes from person to person during close face-to-face contact. Breathing in the virus from a cough, sneeze, or saliva of someone with a smallpox. Touching skin that has smallpox with skin blisters. So by specially spread to others by touching too. So this is a typical pustule filled with fluid. And symptoms includes serious illness like fever, headache, backache, feeling tiredness, that is malaise. After exposure to the smallpox virus, it usually takes 7 to 17 days until illness begins. Fever will be there above 101 degree Fahrenheit or more than 38.3 degrees Celsius. Smallpox generally begins with fever, headache, body ache, and weakness on day 1. And within day 3, small round pox appears and spreads over the face, arms, legs, and inside the mouth. By day 7, that is within a week, the pox turn into a bigger blisters and filled with pus. On day 12, the blisters crust over, stomach pain and confusion can also occur. Week 3 or 4, the blisters turn into scabs. That is within 30 days, the blister will turn into scabs and fall off, leaving pitted scars on the skin. Long-term effects of smallpox include scars, blindness, and deformed hands and feet. So how could you diagnose smallpox? If someone does get a smallpox, a doctor can recognize the disease because it causes a special kind of rash. The rash shows up as a blister on the skin that is filled with fluid and crust all over the body. The smallpox was localized in small blood vessels of the skin and in the mouth and throat as well. So in the skin, it is resulted in characteristics of maculopapular rash and later raised fluid-filled blisters are noted. So with that, you can diagnose smallpox. How could we manage smallpox? The treatment of choice are antivirals, that is tecovirimat, cidofovir, and brincidofovir are the drug of choice. How could you give a nursing management? Nursing management should be focused, and then the treatment approaches also should include supportive measures with antiviral therapy, along with that administration of varicella zoster immune globulin and management of secondary bacterial infection. So how could we prevent it? A vaccine, a type of shot, can prevent infection with the virus that causes smallpox. Years ago, people were vaccinated against smallpox, but that was now stopped. There are no pills that can treat smallpox, but scientists are doing research to try to develop medicine for this disease. If someone does become infected with smallpox, getting the vaccine within few days of becoming infected can lessen the symptoms. India was declared smallpox free on 5th July 1975, and this was effectively eradicated globally through vaccination by 1979. So no other cases was being observed or noted after that. Hope you understood about smallpox. It's a small topic. These are some of the references which I had referred. And thank you.